Babies have delicate digestive systems, and it's crucial to be mindful of the foods they consume. Some foods can be potentially dangerous for infants due to the risk of choking, allergies, or digestive issues. Here are some foods to avoid or introduce with caution. 1. Honey. Honey can contain spores of a bacterium called Clostridium botulinum, which can lead to infant botulism, a rare but serious illness. It's recommended not to give honey to infants under 1 year old. 2. Cow's milk. Cow's milk is not suitable as a primary source of nutrition for babies under 1 year old. It lacks essential nutrients and can be hard on their developing digestive systems. 3. Nuts and seeds. Whole nuts and seeds are choking hazards. Avoid giving them to babies and young children and instead provide nut butters, but ensure they are smooth and not chunky when the baby is older. 4. Shellfish and seafood. Allergies to shellfish and seafood are not uncommon. Introduce these foods with caution and monitor for any allergic reactions. 5. Citrus fruits. Citrus fruits like oranges, grapefruits, and tomatoes can be too acidic for some babies and may cause diaper rash or stomach discomfort. 6. Eggs. Egg whites can be allergenic, so it's best to introduce yolks first and then the whole egg. 7. Highly allergenic foods. While some experts recommend introducing highly allergenic foods early to reduce the risk of allergies, it's essential to do so with care. These foods include peanuts, tree nuts, wheat, soy, fish, and shellfish. 8. Processed and sugary foods. Avoid giving babies processed and sugary foods like candies, sodas, and sugary cereals, as they provide little nutritional value and can lead to unhealthy eating habits later in life. 9. Small, hard foods. Foods like popcorn, grapes, raw carrots, and hot dogs can be choking hazards. Ensure they are cut into small, manageable pieces or avoided altogether. 10. Salty foods. Babies' kidneys are still developing and they have a low tolerance for salt. Avoid giving them salty foods and be cautious about the sodium content in their diet. When introducing new foods to your baby, do so one at a time and monitor for any adverse reactions or allergies. It's always a good idea to consult with a pediatrician or a healthcare professional for guidance on your baby's specific dietary needs.